Hi, this is Sarah Reese with Polk County Public Health. It is January 6th, and I'm here to provide you with a COVID update. The world of COVID and our response to COVID-19 has been quite busy the last couple of months, and we hope that you have enjoyed a wonderful holiday season. With that in mind, we've been busy planning and preparing and now distributing vaccine for COVID, which is quite a monumental moment that we've come to. Getting vaccinated against COVID-19 is one of the best ways to protect yourself and everyone around you. In December, we excitedly received notification that 2 vaccines are now available and have been approved by the Food and Drug Administration, or the FDA, for immunization around COVID-19. So just 1 month ago, we were talking about vaccines coming our way, and over the last couple of weeks, we have had vaccines make it to our area and have excitedly been able to provide vaccines to priority groups in our county. Certainly everyone is important, and we know that vaccine will be available to everyone, and the necessity to have a phased approach is building because of the amount of supply that is available of the vaccine. So with this in mind, there's guidance that is used to determine when people get the vaccine. Federally, the Center for Disease Control and Prevention, or the CDC, has an advisory committee on immunization practices, sometimes called ACIP, and they make the recommendations from the federal government down to the states about priority groups and about who should receive the early limited doses that we currently have available. So right now, you may have heard different numbers described in the media or in communication. So currently, we are vaccinating phase, what they would call 1A. And within phase 1A, there is 3 tiers. And so we are working through those priority groups that have been described for us, and we've been provided direction. So those include healthcare personnel and long-term care staff and residents. And as we get a little closer to home in Minnesota also has a vaccine allocation advisory work group that takes the CDC's ACIP guidance and applies that more locally to Minnesota. So in Minnesota, we also used sub-prioritization criteria, risk criteria, to help us further direct where that initial supply of vaccine should go. To give you a little bit of background about the risk criteria that Minnesota used, I will share that with you now. So the risk criteria considered in Minnesota for making decisions was the risk of infection based on where someone works or lives, the risk of severe morbidity or mortality, so individuals who are older or have comorbid conditions which would make them at higher risk for severe health outcomes. Individuals who have the risk of transmitting it, whether at work or in their home setting, would be considered a higher priority, and also the risk of negative societal impact. So individuals have a higher priority due to the extent with which other people's lives depend on theirs. So for example, healthcare workers who are caring for their family, friends, and neighbors. As you can see, it's not just about risk to the individual. We are looking at it largely in terms of vulnerable populations, vulnerable groups, and also the community impact. We certainly appreciate the strong interest that we've seen from community members about getting the vaccine as soon as possible. And we're so thankful that you have been calling us and have been asking for more information. It's really a clear indication that people are understanding the value of vaccine, about it offering a safe and effective way for us to move forward and move out of this pandemic that we've been dealing with much longer than any of us would like to think or talk about. So with that in mind, we are currently at Polk County Public Health working through phase 1A and taking direction from the Minnesota Department of Health and the Minnesota Vaccine Allocation Advisory Group to vaccinate individuals in Tier 1A. We receive a federal allotment, and then MDH gives us a local allotment, and right now that allotment is very limited. So for example, last week we were allotted 100 doses. So it does take time. We get our allotment based on vaccine supply, and so we are working quickly. We also have a no waste policy, and so it has to be very thoughtful and planned out for how we distribute the vaccine. We have a great team that's working really hard to get that vaccine out as quickly as we get it in, so we really appreciate your support during this time. And if you fall into 1A or 1B or 1C, we will certainly keep you informed, and we will communicate with you about when it's your time to get the vaccine, and really appreciate your support as we move forward. Thank you.